Good afternoon. So Nandini is again here. Thank you for being so cooperative. Like every time I come live, whether informed or not informed, I think some people are always there. So thank you so much. I wanted to quickly discuss the questions of the yesterday's quiz because I am trying to prepare the quiz and give the quiz nowadays on all those topics which are actually important for your upcoming exam. So I have already shared the list of the important topics. You have the list for INI-CET as well as the FMG exam, and I'm trying to give you all those important questions. So you can see the question number 1. I think that is a direct question. The Transplantation of Human Organs Act. So that is Act 1994. If you have any doubt related to any particular question, guys, please post it in the comment section. Live chat mein please post it. So link to the quiz. Actually, there's no link to the quiz. What's your name? Hippie in the house. We are conducting this daily quiz on our Telegram group. If you do not have the link to the Telegram group, that I can share it on the live chat after a while, and you can join in that Telegram group. Daily at 10:30 p.m. we are having the quiz, 10 questions, and on the given topic. Okay. So so shall we start? So I think the first question is very, very clear. The Transplantation of the Human Organs Act, it was in 1994. Then second, the contraindications of the corneal transplantation are all except. So number 1, the very first one is not a contraindication, rather it is a indication. So if you see the video that I have shared with you on the corneal transplantation, that had all the things that I have asked you in the yesterday's quiz, all the indications, contraindications, everything. So if you have not gone through it, I will definitely ask you to go through it. It's a very, very important video, and I'll quickly show you also, because some of the people were asking me where is it. So I'll show you that it is again there, and I have discussed each and everything there. So let me show you this one. See, this is there. The Transplantation of Human Organs Act was passed in 1994. So this is your question number 1. The Transplantation of the Human Organ Act. This is there. All right. Then we move to the question number 2. So if you see your question number 2, just a second. Okay. So see this question number 2. These are your contraindications. So if you look at the contraindications, we have got two kind of contraindications. One is the systemic contraindications and one is your ocular contraindications. So you have here the acute sclerosing panencephalitis, you have got uveitis, iritis. All these are contraindications. The death from the unknown disease, congenital rubella, HIV. But the microbial keratitis which they have given is actually a indication. See this. These are your indications of the penetrating keratoplasty, and if you see one of them is the microbial keratitis, keratoconus, post-cataract surgery, edema, corneal dystrophies and degenerations, mechanical and chemical trauma, microbial and post-microbial keratitis with the congenital opacity. Congenital opacity. So this is your question regarding this. Then coming to the next one, you are having the functional cell density. What is, yeah, so we have a functional cell density. So let me show you what is actually the functional cell. So let me show you what is actually the functional cell density. And I'll definitely say that if you have not gone through this video, I think this is a video which is worth looking at. So see this, the endothelial cell count. So we have something called as critical cell density and something called as functional cell density. Critical cell density is between 300 to 500, while functional cell density is between 1500 to 2200. Again, an important one. There are different, endothelial cell count in the different ages, and you have something called as the critical cell density and something called as the functional cell density. So functional cell density is 1500 to 2200. All right. Then we had a question which was related to the normothermic, and I think there was some confusion about the Amk medium also. So we'll be talking about that also. So see this. This is the storage of donor tissue. Now what I gave you in the notes was according to the Khurana. According to the Khurana, they said that MK medium was lying in the intermediate. But here, if you look here, they are saying that we have got 4 categories: the short term, then we have got intermediate, long term, and then we have got very long term also. Very, very long term is also there. So if you look here, they are saying that moist chamber can remain up to 24 hours, but MK medium can go up to 2 to 3 days. So here they are taking 2 to 3 days and they are saying it's MK medium. So actually the time is same, but here they are including it in short term, while Khurana was including after 2 days in intermediate. So time period remains the same, and I feel that this one is the better one. So that is why I have given you according to this. शॉर्ट टर्म में चेम्बर +4 डिग्री सेल्सियस पे रहता है, विच इज़ अ हाइपोथर्मिक मेथड. सो दिस इज अ हाइपोथर्मिक मेथड, जस्ट यू आर कीपिंग इन अ स्मॉल वाइल. दिस इज द वन. This is a moist chamber. In this you can keep it inside the refrigerator. So this is a hypothermic method. Then we have an intermediate method जिसमें कि Dexol में Optisol, or we can use the chondroitin sulfate. All these things can be there for 7 to 10 days. So this is intermediate method. Now, if this long-term method is a normothermic method. Normothermic means I do not require the hypothermia, and the temperature which is required to be maintained is somewhere between 34 to 37. So here I have a organ culture method. While if I am going with the cryopreservation, this is 1 year. So this is very, very long. This is 1 month long and this is very long. This is your cryopreservation. So are you getting this? I think the query related to your MK medium is clear, and the normothermia is also clear. Yes or no? Yes or no, guys? So this is also clear. So the next question is the functional cell density is 1500 to 2200. Which of the following is a normothermic method? So normothermic method is your B, that is organ culture. MK medium, so we have taken it as A, that is your short term method. Then which of the following is the indication of the tectonic keratoplasty? Which of the following is tectonic? Tectonic means which we are doing to maintain the integrity. So that is your desmetocele, where you have an impending perforation. I told you keratoconus में we are not doing keratoplasty for your the integrity. We are doing it for optical purpose. We are not doing it for integrity. It is just the irregular astigmatism for which we are doing. So it is not tectonic in keratoconus. ठीक है? So this is also done. Which of the following is DELK? Which of the following is DELK? Deep anterior lamellar keratoplasty. Deep anterior lamellar keratoplasty. So deep anterior lamellar. See this. So if you look at this one, look at this. So you have to see the anterior. So if you look at these two things, these are wrong, because these are the posterior ones. These are your posterior ones. So you have to look at the anterior ones. Now this is traversing whole of the cornea. So this is your penetrating keratoplasty. You look at here, this is epithelium, then Bowman's membrane, and this one is a stroma. So here you are going up till here, up till the endothelium. So this is penetrating keratoplasty. Here we are taking the more than half of the stroma. So this is actually your deep anterior lamellar keratoplasty. This is your deep anterior lamellar keratoplasty. So answer will be this one. ठीक है? All right. Then coming to the next question. This image depicts what type of keratoplasty? So if you look at the next question, I'll show you the next one also. Which one is your next one? This image. So see this image, if you look at the tissue, it is involving all the layers. This pink area is involving all the layers. So definitely it is your penetrating keratoplasty. That is why this is your penetrating keratoplasty. This is again very, very clear. Then looking at the other ones, which one of the following is a normothermic method? Normothermic method is your organ culture. We have discussed this, and the short term method. So in short term method also we have discussed, it is the moist chamber method, and then we have got the second was the MK medium. So these are all your questions, and today we are going to have your quiz session that is related to your fundus images and FFA, fluorescein angiography. So again, that is going to be very high yield, and you are definitely expecting the questions from your fundus images, from FFA, diabetic retinopathy, hypertension retinopathy. So again, I'm trying to make new questions for you so that you can have entirely new experience of it. And please go to the video of the fundus images. We have also done two sessions of fundus images for the FMG people. We have discussed two then. So two days we have discussed these fundus images in your discussion day 4 and day 5. So please check out that also. That will be giving you a quick discussion and a quick mini revision kind of thing for the today's quiz. And I think today's session will be again very, very high yield. And if you have any question to ask, you can ask right away this time also. Any doubt, anything. And if you want, I can again plan a rapid doubt session, a quick doubt session for you guys if you want. If you have any query related to any of the ophthalmology questions, then we can also plan a rapid doubt. So do let me know at the direct message or in the group when do you want the rapid doubt discussion, because we are doing a lot of questions, lot of quizzes. So maybe when you are revising all these things, so if you have any kind of doubt, we can quickly solve it. So that was all for this quiz discussion. I wanted to keep it just short, but I wanted to discuss these questions because any of these questions can be asked in the upcoming exam. I hope every question, every query is clear. And in the evening 10:30 we will be having the quiz, and before that we are going to have a revision today of the gaze palsies. So definitely looking forward. If you want and if you have any doubt related to the gaze palsies and the nerve palsies, definitely you can join the live session at 8 p.m. yes, so 8 p.m. it will be starting. And if you have any other doubt also, you can keep your doubts ready. We can be solving that also. So all right, goodbye guys, see you in the evening. Bye bye.